A warm welcome to everybody. Thank you for those that are able to join us for this really important presentation around SAFE-TO, which is City of Toronto's 10-year community safety and well-being plan. It's a plan that really looks to say we cannot move the needle on community safety and well-being with any one partner in the city doing it on their own. It really needs to be a collaborative effort across different institutions, and institutions that historically have kind of moved in a way that is not a joint maneuver, but kind of in silos. And we're really trying to break down those silos through this plan. And so what we're going to focus on today through this plan is a high-level overview of the plan. Christina, are you able to share screen?
Thank you. I'm sharing my screen right now, Jason. Do you see it?
Oh, I do now. Yes. Okay. Thank you.
Okay.
And so you can see we're going to give an overview of the plan, and we're going to talk specifically about the Violence Prevention Toronto office, which my colleagues here are part of. Really excited to have them here presenting with me today. So we have Christina Alexou, who is the manager for building safer communities and family well-being. We have Kevin Bourne, Supervisor, Community Crisis Response Program, Roger Caracciolo, Inspector with SAFE-TO, TTC, and Justice Centers, and myself, Jason Cannon-Carey, Superintendent of Education with TDSB. So we'll talk about the work that our multi-sector partners are doing, and then if more people come into the session, we'll have an opportunity for a question and answer. You go next slide, please. I'm still just seeing the first slide, Christina.
Okay. How about others? It's good.
Still the same slide for me.
Same, yeah.
Do you want me to give it? Do you want to
Maybe
unshare
go
your
into
screen, Christina?
presentation mode.
Oh, it says I am in presentation mode. Sorry, give me 1 second.
Okay, just as you're fiddling with that, I can continue to talk, and hopefully Christina will be able to get it up on the screen. So there we go. There we go. Beautiful. So what is SAFE-TO? So as I said, it's a 10-year plan, and it's really a roadmap for how we can better connect our systems. That's high level what SAFE-TO is all about. Next slide, please. So it encompasses 26 actions that span 7 strategic goals that you can see on the screen there. Next slide. So as we get into the implementation phase, you can see some of the actions that are being moved forward on this slide. Next slide, please. And I think what we really want to hone on today is with the Violence Prevention Toronto office that's been created. It has embedded staff from the different institutions that are helping mobilize SAFE-TO. So we've got a number of those folks representing institutions here today. Beyond the people that we were able to bring in today, I also just want to acknowledge we have representation from Toronto Transit Commission, Toronto Community Housing, Toronto Catholic District School Board, and Ontario Ministry of Children and Community Social Services. So truly a multi-sector collaborative effort to move forward community safety. And so what we're trying to do is really focus on the prevention side of the equation. Historically, our institutions have done a good job in responding to incidents of violence, but we acknowledge the need to put more effort into the prevention side of the equation. Next slide, please, Christina. So in taking that, it's really this notion of a public health approach to community safety. My friend here, Roger Caracciolo, talks about how we cannot police ourselves out of our issues with community safety and arrest our way out of this. we really have to think about what are the supports we're putting in place for families and youth to help them be on a path of well-being. And so in order to do this work, taking a public health approach, it's us thinking about the places that we need to focus on, and we're doing that through data and looking at which are the communities that are experiencing the highest rates of disproportionate violence in their community. What are particular populations that we can focus on to further support? And if we think about who is at greatest proximity to violence and what are some very specific interventions that we can think about, and moving forward, proactive, preventative pieces that we can put in place for those youth, then we're going to get to a space where we're having to respond to less incidents. Next slide, please. So when we think about the data we've been using, we have a map here that shows the 6 zones of the city that are experiencing the highest rates of community-based violence. And so these are known as our 6 safety zones, and these are the zones that we're focusing in on for our efforts. Of course, violence prevention is something that needs to happen across the entire city, and really, incidents of violence don't know any boundaries. But again, these are the 6 areas of the city that are having the highest ongoing rates of community-based violence. And so we're intentionally trying to focus on these communities to enhance supports. Next slide, please. So when we think about community development and mobilization areas, you can see the 6 areas listed here on this slide. I won't read through them all. You can take a moment to read them. And the partners we have today will be explaining and helping bring to life what this actually means in practice on the ground. Next slide, Christina. Thank you. Here again is an example of some of the different programs that we have running, funded programs, work groups, the governance structure that we're using to mobilize SafeTO with an executive leadership table, who are, as the name would suggest, our executive leads in our respective organizations, then connecting to a steering team of folks that are helping lead the change on the ground, lived experience advisory circle, safety networks and intervention tables. And I will add, not really part of the governance, but to help inform the governance, we are going to be starting a parent group to lead citywide violence prevention conversations through a parent network. So that is in the process of being developed, and more information to follow. And I will share this information with our parent engagement office with TDSB to encourage parents to become part of this network. Next slide, please. So this, I'd like to turn over to Inspector Roger Caracciolo, who will talk about the work he's been leading with Toronto Police Service.
Thank you, Jason. Good afternoon, everybody. Again, my name is Inspector Roger Caracciolo, and I'm very happy to be here just to shed some light on the Toronto Police's role regarding our SafeTO Violence Prevention Toronto office. And thank you to my colleagues, Kevin Bourne, who are on the line today, and Christina Alexu. Appreciate the time for both of you being here. I was assigned here to the Violence Prevention Toronto office as an inspector, assigned June 20th, 2023. And my role ostensibly is to lead the SafeTO implementation. What I do is I'm embedded to the Violence Prevention Toronto office team and a contributor to the design and implementation of the office to address gun violence and traumatic events in the community. I'm the TPS lead for TTC, which is anything to do with violent offenses that happen, criminal offenses, and community safety well-being. And that's a collaborative response to crime and community safety well-being. I also lead the Toronto Police Justice Center. There are 2 justice centers currently in process and functioning for about 3 years now. The Toronto Northwest Justice Center, which is the youths, and the Downtown East Justice Center, which is adults, which specifically addresses individuals that are engaged in mental health situations, underhoused, and addiction. And we're in partnership with the MAG, Ministry Attorney General. And what the Justice Centers are is, ostensibly, we move the justice out of the traditional courtroom and into the community setting. So they bring the justice together along with health and social services to address the root causes of crime. And we want to break the cycle of the offending individuals and improve community safety. And there's a planned expansion all across the city for that. So it's been highly successful as we move forward, and we continue to do so. A lot of questions I get moving along is, how does TPS support and drive safe fuel as an organization? Well, I can tell you it's not just enforcement. It's very big on, we follow the guiding principle of do no harm. And in partnership with my colleagues with me today and their agencies, we co-design, co-develop, and co-deliver community safety and well-being engagement, support programming, and referrals to the community following any traumatic event, with the goal of intervention, prevention, response, and recovery. Some of the ways we do that are through our innovative ISCT teams, which is Integrated Safety Coordination Teams. And I lead that, the service's participation and contribution to that regarding the response to any traumatic incident in the community. And we really do that by 3 goals. We concentrate on 3 goals. Goal number 1 is we provide relevant information that may have a critical impact on the identified community and support the development and action through collaborative strategies to mitigate the risk and the impact of violence itself. The second goal is we build local capacity by working with our local safety networks, our community groups, our resident leaders, and we amplify their efforts to not just reduce gun violence, but any traumatic incidents that's in the community at the time. And thirdly, we debrief and assess as a team any potential risks or challenges that are presented, and we support the development and action any collaborative strategies, again, to mitigate the impact and the risk of violence in the communities itself. It's really important, though, that we're not doing this ourselves. And that's why our community partners are here and our services are here. And what I call that is the linkages to the TPS divisions and our specialty units and all the meetings through that. To me, this is mission critical. It's really internal buy-in in our organization and how we mobilize. And we do that through operational awareness, resource allocation, and community engagement. Some of the things we do to achieve that, or I do to achieve that, is robust communication with my command and my divisional unit commanders and our specialty units. A commitment from our neighborhood community officers, who I'm sure some of you, part of the community and TDSB, knows, is to leverage their community knowledge and build upon the trusting relationships they have in the community, understanding the community's views, the community's wants, and what support looks like from the community, not just from what Toronto Police looks like support would be, not only from a victim standpoint of the traumatic incident, but also the point of view from your collaborative contributors, so we solve and support the issues that are coming from the community. Very important that we share this information that we learn with our stakeholders, with our community support agencies, and the community in general. One of the ways we do that too, to make sure that we're doing the right place at the right time, is we do data sharing. And that's part of our SCALE program, which Jason talked about earlier. And you can think about SCALE as it's analytics from all of our contributing agencies in one area, place-based, and we look exactly where we have to go, what we're experiencing, and how we believe after we do it collaboratively. A big thing we've done too is establishing protocols with this team and with the community to make sure, and that's high priority, that we're responding the right way. One of them is the SafeTO DSO notification protocol, which is in partnership with the CCRP, and that responds to any homicide, shooting, stabbings, or any impact in the community itself. We have strong protocols with the TDSB, the Toronto District School Board, when it comes to any kind of emergency or events and notification protocols. Jason and I have worked extensively together on putting that protocol in place, and it's been very successful. We have serious protocols and emergency protocols in place through the TTC when it comes to emergency notification, any criminal acts or traumatic events, and major incidences. We also have a protocol for the occurrence reporting and notification protocol interagency within the TTC. So we know now that we are responding properly, timely, and the right way, and collaboratively along with TTC, not just the police. And again, our information sharing protocol with our specialty units, our gun and gang units, our intelligence, this is done so we are mobilizing in the community and we can identify cross-community conflicts. All that rolled up into with our community partnership engagement unit is one of the units I lead within the Toronto Police Service, and it's true program alignment. We align with our internal, external stakeholders for our youth programs and supports, our adult program and supports, community safety, well-being, all this with the key in mind to reduce gun violence and traumatic incidents in the community. As Jason said earlier, we take the public health approach. Toronto Police has been taking the public health approach to community issues that come up, knowing that we are not alone anymore. It's much easier to take that public health approach when we have such strong community partners with us, some of who you'll meet today. In closing, I'll leave you with a couple of things. Number one, it's important for violence prevention at Toronto Police to identify the challenges, successes, and build off them so we can work together through them. It's a continued partnership to develop the key and build on the trust that we are doing now. It doesn't happen overnight. We have our touch point conversations. It makes us better. As our organizations we drive the strategies, but the outcome for community and safety and well-being comes from the community and what we do together. And I'll close it off with this. We as leaders, we must be consistent, considerate, and deliberate in all things we do for community. Thank you, Jason.
Thank you, Roger. That is, I think, a wonderful overview of the work that you've been leading with TPS, and thank you for the leadership that you've provided in helping mobilize our strategy forward. Thank you, Christina, for advancing the slide. So I'm going to talk about Toronto District School Board. At the outset, I did mention Toronto Catholic District School Board is part of the Violence Prevention Toronto office as well. The students across the city, they're all our students, and so we wanted to make sure both of the two largest school boards are represented, and in fact, we have touch points with the French school boards as well. So with the work that we're doing in connecting to the school boards, it is really critical, and all of our partners understand this. You know, though I started the presentation talking about disproportionate rates of violence in community, we always approach this work from an asset-based lens. There is incredible passion, brilliance, ingenuity in community. And our work is to tap into that, to elevate that in enhancing community safety and well-being. Next slide, please, Christina. Thank you. And so in our joint work together, it's really about that pyramid right there. Nothing happens without relationships. And so we've been spending time over the last year plus to build relationships across our institutions, in community, and in a way where we are accountable to each other. And then through that, we end up in a place of trust right at the top there. And we're building towards that. Is it perfect? No, it's not. But I really feel like we're on the right trajectory. And once we have those three pieces fully in place, we are all really confident that we're going to see really noticeable improved outcomes around community safety and well-being across our city. So some of the ways that we're mobilizing this, when you look at schools, families, and communities, at the beginning of this year, we had a joint school safety and student well-being symposium with over 700 attendees across our different institutions coming together to information share, build relationships across across institutions, and think about ways that they can coordinate their planning to improve community safety and well-being. We've got supports in place for families. We're going to hear more about through our colleagues that are on here today, Kevin Bourne and Christina Alexu, with the Community Crisis Response Program and the Family Wellbeing Pilot. And then in communities, I'll talk about two pilots we have going really a very high level. One is with the Toronto Transit Commission. As I said, they're one of our important partners in the Violence Prevention Toronto office, where we've got a pilot in 3 schools across our district, bringing together our neighborhood community officers, TTC transit constables, TDSB social worker, City of Toronto peer worker, and the peers are young people in their early 20s that have lived experience around violence in their community that can really facilitate deep conversations with youth in our schools in conjunction with our school social workers. And those teams are coming together to develop local-based plans to have youth think about different ways that they can carry themselves on TTC that will really enhance safety for everybody. And also not just placing, all of the work around safety on the shoulders of the youth, but what are some things maybe that the TTC can reconsider as well to further engage you. So those school teams are coming up with plans and ideas right now, and this is being supported by the TTC, where the students involved are getting an honorarium of $499. They're getting a free Presto card for the duration of the pilot that they can use for travel. And this is a way, in this case with TTC, coming together with our different partners to do the joint work of enhancing safety and well-being. Next slide, please. So at this point, I'd like to turn it over to Christina Alexu, who will talk about the Family Wellbeing Pilot.
Thank you, Jason. Good afternoon. My name is Christina Alexiou, and I'm a project manager with the City of Toronto. Really excited to be here to share a bit about the Family Wellbeing pilot program, currently piloting in Zone 5 or Scarborough. The family well-being model specifically focuses on supporting parents and caregivers of young people. So I know that there's a lot of alignment across different programs that are mentioned throughout this conference. So we're specifically focusing on connecting with parents and caregivers of youth vulnerable to violence. So young people ages 10 to 29 who maybe already be involved in violence, maybe involved in the justice system, or vulnerable to becoming involved. So maybe navigating a few risk factors. So we know that there are resources and supports for young people, but sometimes not as many resources and supports for parents and caregivers that are supporting those young people. So that's where this pilot comes into action. So we are working with communities across Scarborough. So on the left-hand side of this slide, you'll see that there are focus neighborhoods across Scarborough, and we also work with 3 focus populations, so Indigenous families, Black families, and newcomer families. So priority are given to the focus populations and the focus neighborhoods listed here. However, if you are a parent or a caregiver across any community in Scarborough, you can be referred into or make a self-referral into the program. I also want to highlight, as many of my colleagues have shared in this presentation, this would not be possible without our partnerships. So the City of Toronto does not directly provide this service. We work with 7 community agencies across Scarborough. Those 7 agencies are Asian Court Community Services, Access Alliance, Taibu Community Health Services, Scarborough Center for Healthy Communities, Native Child and Family Services, Center for Immigrant and Community Services, Malvern Family Resource, and Access Alliance. So we are not providing the direct service. Those 7 agencies are. And the other unique thing about this program is that we lean on the ambassador model. So ambassadors are the folks that actually are working with the parents and caregivers, and they are people who live in these communities that we're working with and focused on reaching. So many of them are already known to families in the community and already have existing relationships. So we really lean on the ambassadors to create that genuine and authentic connection and be the connectors to longer term resources and services. So 3 key areas that we focus on are awareness. So awareness of what are some of the risk factors that increase vulnerability for their young people to become involved? Education. So what are some things that parents and caregivers can do about those things? And system navigation. So if a young person is already involved in the justice system or having challenges throughout the school system, how can the ambassador support the parent or caregiver in navigating all of those different services? So I do want to highlight that the ambassadors are not necessarily the ones providing the case management support or the counseling, but they're really the connectors because they have the deep and impactful connections and relationships with folks in the communities that we're trying to reach. So on the slide, you'll see that there are 3 touch points, but to be quite honest, we've noticed that because the relationship is existing and it's there, the work goes beyond 3 touch points. Folks kind of return back to the ambassador as needed and when needed. So it's not kind of a hard and fast rule that after 3 touch points, families are no longer able to engage with the ambassador. So just encouraging us to think beyond the 3 touch points. And, as I mentioned, this is a pilot, and I think that's something that we learned through the pilot, that genuine connections and relationships are ongoing. So they're not going to stop after 3 points of connection. And so, as I mentioned in the beginning, there's many ways to get connected to the program. So parents and caregivers, sometimes they already have relationships with the ambassador, so they'll refer themselves. Other times, a school might make the referral, or a child welfare system, or through the justice centers, as Roger was speaking about. So there's many different ways to get connected to the program. And then really the goal is for the parent and or caregiver to be connected to long-term supports and services. So if there are financial restraints on the family after the connection to Ontario Works or ODSP, the hope is that there's that long-term connection to meet the need or the goal. And although the ambassadors aren't working directly with the youth, they're also able to provide resources to the parents or caregivers that support the youth. So if, for example, a young person might be vulnerable to involvement in a gang, they can make a referral for the young person to a program you'll hear about a little bit later called Towards Peace, which is a violence interruption program. So my contact is available at the very end, but I'm interested in and looking forward to connecting with folks on the call. And I will pass it over to my colleague, Kevin, to share a little bit about CCRP.
Thank you, Christina. Can folks hear me okay? Thank you so much. So once again, my name is Kevin Bourne. I am a supervisor with the Community Crisis Response Program with the City of Toronto. The Community Crisis Response Program, we work across the City of Toronto, providing, supports, resources, services to communities that are impacted by violence and traumatic incidents. How we do this, just as my fellow colleague said, collectively, collaboratively, right? We work with communities, and that's the broader communities. That's TPS, the school boards, internal partners, external partners, agencies, parents, grassroots groups, everyone, right? Trying to figure out, well, one, help support in terms of providing supports and services after a violent traumatic incident occur, as well as collaborating with folks around how best do we look at safety and what's impacting folks and how it is we can address some of those things. Right? Mobilizing resources can include anything from individual needs, whether that be a victim, victim's family, or right across the community. So looking at things that are impacting communities, holding stuff like community debriefs, supporting with town halls, information sessions, where folks can really tap into, what transpired, and what are the supports and resources in play to support their healing and their wellness. And, some of the work that the program does, we work with local safety networks. These safety networks are collections of different partners within local communities that look at different things. So that could be, things around safety planning, looking and addressing some of the safety concerns and issues within communities, as well as mobilizing and connecting around supports and resources after the violent traumatic incident has occurred. There's also different local initiatives and safety projects that we work with community with, trying to ensure that we're focusing on healing and recovery. One of the aspects of our program is the Community Violence and Wellness and Recovery Program. And this more is just looking at enhancing access to culturally responsive trauma-informed supports. In addition to that, we also have the Community Crisis Response Fund, a one-time funding of up to $5,000 that a community can access to support with any community healing, capacity building initiatives that, folks can tap into once to help support, again, that recovery, that wellness after a violent traumatic incident has occurred. This talks a little bit about some stats. Relatively, throughout the course of the year, the program responds to roughly around 600, give or take, incidents a year. And I'm saying that because that's what it's kind of been like for the past few years. I think 2019 we had an all-time high. It was 798 incidents we responded to across the city of Toronto. But it's been relatively, it's usually around 600, give or take, a year. Right now, as it stands, we're year to date, we're sitting at around 594, so we're just about to hit that 600 mark. probably going to exceed that a little bit before we head into 2025. And that's it for the Community Crisis Response Program in a nutshell. I think I'll also do the next slide, which is on behalf of some of my colleagues in the city. Serena also is the manager of Towards Peace, and Keisha Richardson, who's the supervisor. So very high level Towards Peace, because I say very high level because I won't speak to their work with justice the way I know they will. So Towards Peace is really made for risk intervention model that really focuses on addressing elevated levels of gun violence in different areas of the city. The program currently right now runs in the Northwest, focusing on communities in Rexdale as well as Jane and Finch, and also in Scarborough, where the communities, I believe, is West Hill, not Malvern, but they have reached into Malvern, West Hill, and Woburn. The program really focuses on a four-pillar approach of engagement approach, I should say. So there's violence disruption workers. So violence disruption workers are local folks within communities that have that pull, that have that connection, that can, when violence is being escalated, there's the likelihood of violence that is going to occur. These folks have the connections where they can help mediate a violent incident from occurring. And these are folks that are located and embedded within community, hence why it is they have that reach and they have that pull and the connection to some of these folks that are at the center of violence. Another level of engagement is the eVibe online violence intervention model. What eVibe is it's an online approach to violence interruption. So looking at content online that can potentially lead or can potentially lead to or escalate violence, and trying to work with different partners around how best we are able to interject and neutralize what's happening. Some other aspects that they focus on too as well is also sharing some of the good content around what communities are doing in terms of work around safety and around violence prevention as well. Another engagement approach is the hospital-based approach, and this is working with Sunnybrook Hospital as well as St. Mike's, where they have a case manager that is specifically assigned to connect with folks that are coming in that have been impacted by gun violence. So this is providing a bedside case management approach where from onset folks begin to get connected to all the different resources and supports that are available to them via the hospital as well as within community too as well. And the next piece is just around capacity building and investments. And that's just, building up the capacity of the program, as well as putting key investments into some great initiatives like the Mastermind Project and the Peace Project and the Care for the Caregiver Project, which are all different fundings as well as events that community can tap into around, which targets and focuses again around, peace, neutralizing violence, and really supporting and investing in community. And that is it for Towards Peace.
Thank you, Kevin. And that brings us to the conclusion of our presentation. You can see the contacts for the various presenters here today. And we also included Serena, who is the manager for Towards Peace, but could not join us. But you have her contact information there. Huge appreciation to my team that came and made some time on a Saturday to support this presentation. Thank you again, Kevin, Christina, and Roger. Now is an